Today we are going to talk about the legalization of medical marijuana, and we also interview Dr. Ofts, who works in community voluntary medicine.
So, some medical marijuana facts are that it is now legal in 25 different states, also in PA, but only in vapor form. Another thing is that it is still refrained from smoking or growing at home. You must have an issued patient ID card in order to get the medical marijuana. Dependency is far less than alcohol, cocaine, heroin, or nicotine. 14% of adults and 23% of high school students reported using cannabis in the past year. A regulatory approach will allow us to migrate the negative health effects from avoiding the broader social impacts. 1/5 of the country's population now doesn't need a prescription to buy marijuana. Projects a national marijuana market of $22 billion. Medical marijuana should be legalized because it has been proven to help nausea and vomiting that could come from chemotherapy treatment with cancer, muscle spasms that come with multiple sclerosis and paralysis, and also it can help treat appetite loss associated with HIV or AIDS and certain types of cancers.
So, what is your opinion on the use of medical marijuana with patients that have an illness that can be treated with it?
I think there are two questions and they're sort of related, and one is the legalization of marijuana for recreational use. Like it would be regulated in a way similar to alcohol, that piece. And then there's legalization of marijuana for medical reasons. Now, I spent about a decade working in pharmaceutical drug development, so I have an interesting perspective on, having lawyers determine if medical marijuana should be legalized, because every medicine that you take or you get prescribed or is sold in the drugstore has gone through established clinical trials to prove that it works, and also to define what are the side effects, and then to try to define if you take this dose, what happens, and if you take that dose, what happens. So with that as my filter, I feel like the legalization of medical marijuana actually sidesteps that process, and that's not in the interest of the patient. That being said, I do think that there are uses for marijuana for medical purposes, but I think that it should undergo the same development as any other drug that you would take. I know that there's some hurdles to that, and part of the reason is that since the federal government still considers it a scheduled substance, then different labs and different researchers aren't able to run clinical trials with marijuana. So you're kind of stuck. You can't do the trials because of one set of laws, and then states are passing legislation at the state level for medical marijuana legalization. My personal feeling is that the reason that states are starting with the medical marijuana piece is it's really a step towards legalization of recreational marijuana. And I think that's flawed logic scientifically and medically, but I understand why governments are doing that. And I think a big motivation is that so much law enforcement cost and so much work is being spent in enforcing minor possession charges and things. It's like, taking a mallet to something that's a tiny problem. And then plus you can get all into the question of civil rights because certain, people with different backgrounds get prosecuted differently and all of that.
Medical marijuana and President Trump. He takes the nuclear option and wages war against both recreational and medical marijuana. Medical marijuana is left in place, but recreational use is terminated. Existing markets are left alone, but new states are delayed or blocked. Status quo remains. Nothing changes. The Trump administration openly supports the cannabis industry. 42% of polled Republicans support legalizing marijuana, a number that has doubled over the last 10 years.
Do you think that the legalization of medical marijuana will help the economy?
I think it absolutely has the potential to help the economy. You're saving law enforcement costs by changing what is a crime. And as it is, law enforcement can't do everything that they're called upon to do because there's only so many resources to go around. So it would free up some of those resources. But then also, you'd have the opportunity to tax it, and that would be income coming into local government.
Is there any bad side effects from medical marijuana in pill, vapor, or oral form?
I think another problem with this conversation around legalization of medical marijuana and recreational marijuana is I think that it gives this false illusion that there is increased safety. And I think that's because the general public is hearing all of this discussion about legalization, and so they're inferring from the discussion that some research has been done or there's some scientific reason or some proof to show, well, actually it's not dangerous, there isn't a problem if you drive when you're using it, or there's no addiction potential or anything like that. And I think that I've heard that a lot, actually, especially among young people. And with the discussion being held in a legislative place instead of in a scientific place, it gets really distorted. I also think that there, along with easier access to marijuana, there needs to be better information about some of the downsides. Like it is an addictive substance, and especially when younger people get exposed, the chance of addiction is higher. Like if you're 30 and it's the first time you're exposed to marijuana, your chance of addiction is lower just because of brain development. Your brain development is done at that point. And I think that there's also a misperception that it's safer to, smoke marijuana and drive rather than drink and drive. Because the message has been received, like, don't drink and drive, don't get in a car with someone that's driving or drinking, but that message hasn't come through with marijuana. So I think there's a lot of educational stuff that needs to go along with that to help whatever path, we're going down to stay safer.
Okay.
So do you think the medical marijuana will become an established treatment in Pennsylvania?
I know. I do know that there has been some activity in Harrisburg around legalization of medical marijuana, and if I remember correctly, actually some legislation was passed approving it. And I know that the Department of Health and different medical organizations have been starting to share with medical practices information as to how to prescribe it and what are some of the restrictions there, but I don't know the details on it.